talk about the county numbers.
Okay, Trevor, I'll start off with the county's numbers. And first, I'd like to start with Happy Nurses Day to all the nurses. You are our heroes to our community. And the health department would like to show appreciation to our public health nurses working the investigation and contact tracing, as they're just all amazing. Today's number, positive is 90, negative 1,245. Recovered are 63. Total tested is 1,405. There are 4 deaths and 70 pending. The drive-through numbers, there were 18 tested today. The total calls are 192. There have been 3 positives, 36 negative, 13 pending, for a total of 52 tested. We'd also like to remind you that while out in the public, please take precautions. Just because the community has started to reopen, it does not mean that the threat's over. It's important to remember COVID is still in our community, and we must protect our families and others. When an individual has been tested for COVID-19, we highly recommend that they self-isolate at home until the results come back. Just because you're tested, you don't know the results until they come back. So please don't go out into the public. We're asking the community to continue to be vigilant and take proper precautions to protect the others and eliminate the spread of COVID in Ector County. And if anybody feels they've been around a confirmed case, please self-isolate and contact the health department. Thanks, Trevor.
All right, thank you, Commissioner Shelton. Russell, MCH numbers?
Yep, I'd like to echo the commissioner's comments. Thank you to the nurses today. I've been outside cooking burgers. My forehead's a little red right here. I smell like a big greasy cheeseburger, but I did do the quality control on the hamburgers, and I think everything turned out a-okay. But a special thank you to our frontline and every nurse in our communities. Thank you for what you do, for all the things that most people couldn't handle, and thank you for being the heroes on the front lines. And we just appreciate all the nurses, and also most of our nurses are mothers, so with Mother's Day right around the corner, thank you to all the nurses and the mamas. For medical center, our number is 785 total tested. That's 785, with 55 of those being positive. 3 positive in the house right now, and none of them are on the ventilator. So we just have 3 in house, and none of those are on the vent, so that's good. 712 negatives. We have 18 tests pending, and sticking with our current trend, we do not have any patients under suspect in the hospital today. So that's good news. And but our total remains at 55 positive total tested so far. And before we hang up, remind me, I think if we could have a discussion about our frequency of these meetings. But before we hang up, let's have that discussion, if that's okay with y'all, and make sure we're good with our frequency. So with that, I'll kick it over to Kristen and let her take it from there for a minute.
Thank you, Russell. Just a quick update on our staff quarantines. We do still have a few nurses that are out on quarantine. Those are not new ones. Those are the 2 individuals that we have already previously reported. We're just waiting on their 2nd and 3rd test to come back as negative. The other ones that are on quarantine at home are the housekeeper that we reported to you, and we have since put another housekeeper on as well. There's no patients to report that individual was interacting with. She just happened to be someone that rides with our other housekeeper back and forth from work. So we went ahead and put her on isolation, and we're going to be monitoring her as well. That's all for the staff quarantine, but not to sound redundant, but I want to make sure as a CNO that I say thank you on the actual 200th birthday of Florence, or I should say Florence Nightingale. Her anniversary is impactful for all of us across the nation, and it's with the lady with the lamp is what we call her. Her whole thing was about carrying a new light into times of darkness. And I think it truly speaks volumes for what we're currently going through. We're creating algorithms and charts and care plans and things that we've never done before related to COVID, and all of the patients that we're seeing. Everything that we're doing in our current times is us carrying a lamp into the darkness. So I just wanted to say thank you again to all the nurses today as we celebrate Florence Nightingale's 200th birth. You're making a difference, and you're actually illuminating a path to a healthier tomorrow, and I can't say thank you enough. Trevor?
They call my name?
I'm done.
Oh, okay. Sorry. I thought somebody else, I thought it was coming from somebody that wasn't on video. I apologize. I'll send it over to Stacy now from RMC.
Thank you, everyone. RMC's numbers as of now, we've tested 316 individuals, still only 14 positive, which is good news, 298 negative, and then 4 pending. I would also like to acknowledge the Nurses for Nurses Day. Of course, we all know that nursing is a calling, and we are so grateful for the nurses that work at our facility and throughout our community who put our patients first, obviously every day, but no more so than they have over these last few months. So thank you all so much. We appreciate your dedication and are very, very grateful for all you do. Thank you.
And Dr. Sarah, there you go.
Thank you, Trevor. Definitely want to echo the sentiments for Nurses Day. May 6th is special. That's our Nurses Day celebrated internationally, and it's the whole week that we celebrate, culminating with May 12th, which is Florence Nightingale's birthday. You know, I want to give you guys a little bit of story on this. Nurses haven't always gotten the appreciation that they deserve. In fact, in Florence Nightingale's time, nursing wasn't even considered a respectable profession. She had to, before she became a world famous nurse, she had to convince her parents to let her go into the field. Things have changed quite a bit now, and these days there's a lot more people recognizing how important nurses are, not only for their medical skills, but for the compassionate way in which they put them to good use. In fact, nurses are so important that they deserve their own holiday now. And so International Nurses Day, celebrated throughout the world. If you see a nurse and you're running out of things to say, let me tell you a few things that I would say to all the nurses that I see. Nurses are our heroes, and compassion is their superpower. Nurses Week, your hard work and skill and compassion make the world a better place. Thank you to all the nurses out there who put themselves in harm's way to help others, and we appreciate their sacrifice. So that's just one of many few things I would say to nurses this week. I am lucky to work with some really great nurses at ORMC and at Scenic Mountain, and I have in the past in many different places. And I consider myself very lucky to be a doctor working in the presence of these individuals that carry out the bedside care, and everything that the doctor orders, they'll write it on a piece of paper and they'll walk away, but the nurse is the one that's standing there making sure that happens. The nurse is the one that's standing there. She's the first one, he or she is the first one to catch whether something is going to go wrong and alert the doctor before it happens. So we couldn't do what we do without them. So thank you very much, and happy Nurses Day.
Thank you, Dr. SARAVANAN. Before we get to media questions, Mayor Turner, do you have any words to add?
Yes, I'd like to repeat what many have said. Happy Nurses Day, and thank you for your tireless work, especially through a pandemic like this. You truly have saved a lot of lives by doing what you do. I'd just like to remind everybody a couple of things when you're out in public. Even though we have started opening up more, make sure you look at it in a way that you can make sure you're sanitizing things you touch. I know some people have mentioned pens. Maybe somebody at a store, you need their pen. Make sure you sanitize your hands after that. If you take your car in for service, make sure you're sanitizing your car when they get out of your car. Those things like that are going to stop the community spread. There's so many out there, but just think like they taught us in defensive driving. Think the same way to make sure that you are not passing this or getting it passed to you just by the same things, opening doors, things like that. So that's what I'd like to remind everybody.
Thank you, Mayor. Looks like first up on the list today that I see is Danny.
There we go.
This is for Commissioner Shelton. Have you had any information regarding Big Daddy Zane reopening today, trying to reopen?
No, I don't have any information on that. And when I reached out, there's an ongoing investigation, so they're pretty much tight-lipped on what's happening there.
Okay, that's it. That's all I have for today.
All right, thank you, Danny. Laura, you're next.
Thanks. I'll echo thanks to all the nurses. You're so appreciated. I guess my first question is for David Turner. The hairdresser in Dallas, she was fined $7,000 and got 7 days in jail for defying the governor's orders. And then the governor today issued a statement saying that that's harsh and not really what he intended. With Anytime Fitness, and I know the bar is out in the county, but Anytime Fitness is in the city, and they've had, I guess, one citation. What is the appropriate measure to take when people are defying the governor's orders?
Well, make sure I'm okay. Make sure I'm not on mute. We have decided to do it in a progressive state, so we can actually give them a warning first. Then, of course, you can give them a ticket. They can either receive a ticket the next time or be arrested. If we do not enforce the governor's law, we, as the city of Odessa, can be sued by the Attorney General. I did some research into that. As far as the nurse and the hairdresser in Dallas, I'm not real sure, because I'm not a city attorney, how she could be fined $7,000 when the statute or the executive order only says you can be charged $1,000 or 180 days in jail. So I don't know the particulars of that situation.
If Anytime Fitness continues to try to open each day, where are you in that continuum between the ticket and then the arrest? How many times, what is good enough?
Well, I think I'm going to leave that up to the officers. I know the officers have talked to them multiple times, and I fully support the officers if they decide they're going to arrest. You know, if you've been warned multiple times, if you're arrested, really it's on your shoulders instead of ours, because you are defying the law and defying the governor's orders. So I haven't heard today if he's open or not. Last time I heard he was open was when the protesters were there. But I may drive by there this afternoon to see.
I think there was another protest there just a little bit earlier, and then there was also one out at the sheriff's office over the bar situation between the guns being carried and whether or not that bar could open. What type of, speaking of that bar though, while I was asking you, David, the bar owner said that she got kind of a green light to open with 25% from texting you and asking you some questions about that. Do you know anything about that?
I don't know anything about it. A lot of people have Facebooked me or not messengered me. I don't recall that, but anything in the county, I can't authorize anything because that's not my jurisdiction. So,
okay. And for our hospital officials, on some of your furloughed employees, how do you know how many have come back so far? And do you have any plans on when you'll be bringing back some of the others?
I'll be happy to answer. On medical center, our staff coming back has been very limited, just because the inpatient volume continues to stay at a low rate. Our ER volume is still pretty off by probably 50%. We have seen some few come back in our operating rooms and our surgery, the surgery part. And so we see that coming back as those open up more and as that demand. The three-headed monster we talked about a couple of weeks ago, and I think we are seeing some of that, is people who were probably scheduled or needed to have some surgery work done one, we're seeing that they're not still comfortable coming out in the public, like into the hospitals. And two, their status on their insurance has changed. And so that is creating some difficulties with some patients having a source of insurance or payer. So that's going to slow down how many cases we can do. And then of course, that'll slow down how fast we return those employees off the furlough.
Okay. Stacy, what about it at ORMC?
It's pretty much the same, Laura. At Odessa Regional, we did have some of our surgical staff that was furloughed, and most of those were actually voluntary, with nothing taking place there for so long on the surgery side of things. So those are the main ones that are back. I would say probably about 10 employees, but otherwise we're very cautiously monitoring the volumes and the needs and reviewing them on a case-by-case basis, because as Russell said, it's the same at Odessa Regional. Our volume's not anywhere close to normal levels across the hospital. So as you know, Odessa Regional is a private hospital. We don't receive any tax funding at all, even though those who do, that's an issue too with the economy where it is. But we have to be able to operate and do so in a fiscally responsible manner. So it's going to definitely be a staged process, I would say probably over the next few months as we see things change.
Okay. Thank you. That's all I have, Trevor.
Thank you, Laura. Marcos, do you have anything?
No.
No? All right, looks like next up I can see Jared or Dylan. Are you guys there? Do any of you guys have questions?
I have some questions, Trevor.
Okay.
Dylan. So I guess just kind of for the doctors, what can you attribute, to the statewide spike on May 2nd? Is it kind of more access to testing, or could it just be a byproduct of the economy reopening?
I can probably start with that if you like.
No, either way. I think it's probably a byproduct of testing. Certainly we're doing some more testing in the areas. Again, we had the National Guard come up and test up here, and the availability of testing is more. And so I think we expect to see more testing. I think what we do with that testing is going to be even more important, whether we're going to be able to contact trace people, where this is coming from, and if it's in certain community areas, and be able to direct our care with regards to those areas. But I think that's probably going to be the main thing. We're certainly not seeing the overwhelming hospital numbers in this area, which is good. But we certainly are seeing our numbers increase.
Right. The only thing I want to add to that, everything Dr. Davenport said, and you specifically asked whether we think it's because of the reopening. It's too soon to tell. I think the incubation period, if you look at it, is up to 14 days. And so we'll have to see what the repercussions are of people not following social distancing principles, even though we're trying to reopen in stages and slowly. We'll see that in about week, 2 weeks time frame.
Okay, and I think this one's kind of straightforward too, but with things reopening, people are, in a sense, families are going to kind of want to come together a little bit, but do practices like social distancing and small groups still apply as Mother's Day weekend approaches?
Oh, absolutely, without question. And without those, we will most definitely see a spike come up. So those principles are very important to continue to follow. We definitely need to keep the social distance. We definitely need to wipe up the high-touch surfaces. Definitely need to try to wear masks when we go outside and try not to congregate in very large groups. All of those still very much apply. And if we do follow through with those principles, we can still have some level of normalcy return, be able to go to a restaurant and enjoy that in-restaurant experience while still being able to safely socially distance and keep each other safe. I think all that is possible. It's just, it's not all or nothing. It's a staged reopening. And so we need to be cautious while we're doing this reopening.